Assalamualaikum. Syukur kita keadaan ilahi ya. Yang ni adalah Kak Lela punya next video. Tapi video kali ni agak istimewa kerana Kak Lela dapat satu maklumat penting ya untuk pesakit-pesakit lah, kita panggil sebagai pesakit lah kot ya, untuk ADHD dan autism sebenarnya. Cuma Kak Lela menamakan ADHD di sini sebab Kak Lela dah kata untuk Madam Laila's channel, target Kak Lela ialah untuk mendidik masyarakat mengenai apakah itu, bukan mendidiklah, berkongsi dengan masyarakat apakah itu dia dimaksudkan dengan attention deficit hyperactive disorder ya. Dan saya harap semua dah sedia maklum yang ADHD ini adalah satu daripada masalah kesihatan mental sebenarnya ya. Cuma di negara Malaysia kita tak nampak lagi masalah ini dah. Tapi nanti slow-slow lah saya akan terangkan, dan kepada siapa yang baru saja subscribe dan menonton Madam Laila's channel, boleh cari di bawah keyword ADHD lah. Dekat video, ada banyak video dalam ni dan kita boleh tengok ya. So berbalik kepada International Psychology Center ya, Alhamdulillah Kak Lela dah dapati ada dekat Taman Desa di KL ya. Kalau tengok alamat dia tu, kalau website dia pun ada di situ. Jadi bolehlah kita cari, dan Alhamdulillah Allah membenarkan, mengizinkan Kak Lela berjumpa dengan Mr. Tommy dan Dr. Edward Chan ya. Pada hari berkenaan saya telah Google Meet dengan kedua-duanya dan saya telah mendapat izin untuk mempromosikan lah ya, walaupun dia ada website. Tapi Kak Lela percaya tak semua orang tahu apakah yang ada ditawarkan di sana. Jadi untuk lebih detail boleh pergi ke info at psychology.com.my lah ya, ataupun dia punya website sendiri. You type je dekat Google International Psychology Center. Okey, sekarang saya nak menyorot mengenai autism lah sedikit sebanyak lah ya. So ini statistik yang saya dapat daripada 2021 ya, mengatakan bahawa melihat kepada apa yang kita lihat di situ, satu daripada 160 kanak-kanak ya sebenarnya dikenal pasti pengidap autism. Itu dunia. Dan saya merakamkan rasa bukan nak katakan lebih-lebih sangat berduka cita, sebab saya percaya, saya yakin Allah Ta'ala memilih kita sebagai ibu bapa kepada anak-anak autism ni sebagai satu madrasah kehidupan ya, ujian. Ya, kita belajar. Macam saya sendiri ya, apabila saya dapat anak autism, saya rasa mula-mulanya memang mana ada orang yang anak-anak dia tak sempurna ya. Tapi sebenarnya percayalah ya, ini mesej saya kepada ibu bapa yang ada anak kelainan upaya OKU ya. Saya terpanggil untuk berkongsi ya. Dan autism ni sebenarnya adalah Allah uji kita ya, yang mana anak kita ada impairment dari segi kita panggil neurodevelopmental disorder. Dan autism dan ADHD ni menarik minat saya kerana anak saya dua orang ya, Muhammad Tajul Iman dan Muhammad Aldi Irfan. Ya, dua-duanya adalah pengidap autism ya. Cuma Muhammad Tajul Iman dah 18 tahun ni dia severe for both autism and ADHD, manakala Muhammad Aidil Irfan ini dia adalah mild for both ya. Dan saya berdoa kepada Allah Ta'ala untuk ibu bapa yang ada mendengar video saya, melihat, menonton video saya ni. Yang pertama, Kak Lela dah tulis kat situ dah statistik, nampak satu daripada 160 kanak-kanak dunia ya. Maknanya nampak macam kecil kan ya. Begitu juga di Malaysia tu ya, kita nampak ada satu daripada 68 kelahiran didapati kanak-kanak ini ada menghidap autism. Tapi ini saya dapat statistik daripada website NASOM ya. NASOM ialah National Association for Autism lah ya di Malaysia. Jadi Kak Lela harap masing-masing sekarang ni zaman teknologi, semua di hujung jari. Jadi Kak Lela nak adik-adik semua pergilah tengok website NASOM tu, dan saya minta maaf mungkin saya tak dapat latest statistik ya. Cuma untuk menjentik perhatian lah kawan-kawan di kat luar sana ya, anak-anak murid mungkin yang berminat untuk tahu mengenai autism ini. Antara lain tahun 2018 punya statistik kalau dari segi negara-negara di dunia, India didapati teramai ya mempunyai golongan autism di kalangan kanak-kanak lah ya. Dan kalau nak dilihat daripada negara kita sendiri ya, dari segi kanak-kanak tu bolehlah dikatakan orang kata kita mungkin tidak berapa terkini dari segi statistik yang kita nak memberitahu ya, tapi cukuplah kita ambil statistik yang dilakukan oleh NASUM dalam website berkenaan ya. Cak Kaila pun tak adalah check dengan detail, tapi saya berharap itu adalah latest statistik ya untuk anak-anak autism. Sebenarnya bagi Kak Laila lah ya, no matter how many cases of autism, sebenarnya dia bergantung kepada penerimaan kita ya sebagai seorang ibu bapa. Macam Kak Laila cakap ya, pengalaman Kak Laila sendiri, perjalanan Kak Laila untuk meniti satu cita-cita yang daripada Kak Laila kecil memang Kak Laila masuk matrikulasi tu lagi kuat sangat minat untuk orang kata menjadi doktor falsafah ya, PhD. Tapi Allah Maha tahu ya, perancangan dia sangat bijaksana. Ya, bila Kak Laila balik dengan tanpa PhD ke UiTM pada tahun 2013, sebaliknya membawa 2 anak syurga, bagi Kak Laila sangat banyak my ups and downs, jadi tak bolehlah nak terangkan kat sini sebab hari ini pertamanya nak share dari segi treatment kan. So nanti Kak Laila ambil sesi lain untuk menerangkan dari segi lubuk hati Kak Laila sebagai seorang manusia biasa yang diuji Allah dengan 2 anak autism. Bukan hanya autism tapi memberatkan keadaan dia kerana mereka adalah ADHD. Ya, autism mungkin orang dah jelas sebab banyak orang share dekat website masing-masing. Artis Zarina pun ada share ya. Tapi Kak Laila nak Syakira, kalau tak silap dekat YouTube ada nama Syakira. Kalau tak Kak Laila salah tolong betulkan ya. Pergilah tengok, ada macam-macam pasal autism, insya-Allah. Dr. Asnah Toran pun dengan I Kurnia dan sebagainya ya. Okey, Kak Laila nak cerita tentang ADHD pula. Okey, ADHD macam Kak Laila katalah ya, kebanyakan ibu bapa yang diuji ya dengan anak-anak yang hanya ada autism. Bukan Kak Laila nak merendahkan ya, bukan nak kata ringan ya, mungkin tidak seberat yang ada kedua-dua ciri inilah ya, neurodevelopmental disorder yang satu lagi iaitu attention deficit hyperactive disorder ya. Yang ini yang orang Malaysia terlepas pandang. Sebab itulah manusia yang bernama Nur Laila Mat Tahir yang sedang bercakap dekat Madam Laila's channel ni ya, tak tahulah ya sampai bila saya akan dapat meningkatkan kesedaran bersama-sama dengan rakyat Malaysia ya untuk menerima keadaan ini sebagai fikiran yang terbuka, kerana saya sendiri amat pedih ya. Macam yang saya katakan, I am an adult ADHD. Perjalanan saya bukan sesuatu perjalanan yang mudah. Tak perlulah saya terangkan sebab saya kalau nak bercerita mengenai ADHD sendiri, saya punya ADHD simptom antaranya ialah saya ni seniwati air mata. Ya, saya mudah mengalirkan air mata. Mungkin impulsivity saya dari segi kesedihan saya tak pasti ya. Tapi inilah yang nak saya sharekan bersama ya. Okay, let's look at the statistik pula untuk ADHD ya. Kalau dilihat dari segi dunia, 5.29%. Saya minta maaf sebab biasanya saya kalau buat ceramah ke apa, dia punya slide is in English. Tapi saya akan terangkan dari segi bahasa Melayu sebab target audience saya adalah Malaysian, Indonesian, Singaporean, Brunei. Ya, yang memahami bahasa Melayu, dan saya percaya tak ramai orang yang mungkin boleh berbahasa Inggeris. Ni sayang, saya minta maaf. Cuma cuba tengok kat situ, kanak-kanak 5.29. Ini dari segi prevalent yang dilaporkan oleh World Health Organization ya. In fact, kajian yang saya ambil ni adalah kajian meta-analisis pada tahun 2020 oleh the Global Health Epidemiology Reference Group, GHERG ya, dalam International Journal of Epidemiology. Saya nak menyebut pun kena berhati-hati sebab saya bukan medical doctor ya. Okey. Apa lagi nak cakap ya? Again kalau kita tengok 2.5% di kalangan dewasa pula ni. Ini nak cakap ya, di kalangan dewasa 366 juta adults di dunia. Nampak tu, orang dewasa. Jangan tak tahu ya, orang kita mungkin kurang lagi tahu mengenai ini. Sebab itu Kak Laila terpanggil Ya, Allah beri Kak Laila. In fact dari segi diagnose Kak Laila pun, Kak Laila melihat anak. Padahal anak tu dapat tahun 2003 seorang lahir. Tahun 2006 seorang. Saya tak sedar-sedar. Sampailah ke tahap yang saya dah berumur 49 tahun. 2020 itulah tahun saya mengenali bahawa saya adalah seorang ADHD. Nampak tak? Ya. Sebab itu di Malaysia, kita tengok itu kadar di Malaysia prevalent 1.6% hingga 4.6% kanak-kanak di Malaysia. Agak tinggi juga. Kalau kita tengok 1 daripada 68 kelahiran, yang ini napsom ni saya tumpang yang autism tadi ya. So saya harap janganlah dikelirukan ya. Saya pun sebenarnya tersilap juga dari segi mengedit. Tapi saya harap janganlah ambil besar benda ni ya. Kak Laila cuma nak share dengan you all bahawa prevalent ADHD di Malaysia di kalangan children agak tinggi. Ya. Sebab prevalent dunia 5.29 dah tak jauh dah tu. Ya. Cuma apa yang Kak Laila nak highlight dekat sini adalah antara intipati kepada perkongsian dengan masyarakat ialah supaya anda semua cubalah diagnose anak di peringkat awal dan mengenali International Psychology Center yang berada di Taman Desa KL memberi harapan baru dan Kak Laila akan ambil peluang dalam video ini. Kak Laila akan tinggalkan sekejap nanti ya, selepas minit ni Kak Laila cukup, Kak Laila akan buka session yang melibatkan perbualan Kak Laila dengan Mr. Tommy dan Mr. Dr. Edward Chan daripada makmal yang berkenaan lah daripada International Psychology Center ni ya. Jadi Kak Laila untuk sesi Kak Laila video ni sekejap saja nak menunjukkan statistik dan memberitahu bahawa ADHD dengan autism ni adalah neurodevelopmental disorder. Itu saja bahagian saya. Ya. Jadi sambil saya nak menunggu video seterusnya yang saya rakamkan perbualan saya dengan Dr. Edward, saya mohon anda stay ya, sampailah penghabisan video ini nanti ya. Okey, saya ucapkan terima kasih dan bolehlah bersedia.
This mom, they are very double, triple in problem with the PDPR at home, you know, with the work from home. I think, sorry to say, women are more like susceptible for emotional disturbances during this COVID era.
True, yeah.
Dr. Edward, you mentioned about medication just now. You have your lab kind of thing. Can I ask you something?
Yes.
When it comes into the brain scanning, I do not know, maybe I still have to do further reading. Can we do some scan of the brain for the young adults so that we can see the frontal lobe kind of thing? Do you have the technology here in Malaysia?
Well, what we have is a test, a urine test that can look at the neurotransmitters, right? The brain chemicals. So with ADHD that would be normal deficiency in dopamine, in GABA, right? So these are key neurotransmitters. So we can identify those, right? Using a urine test that our lab can run. So
I'm still not familiar with the test, by the way.
Yeah, no worries. Tommy can brief you on that, and it is a very easy test to do. You need to do it at home. We can send the kids to to patients that want to do the test, and then they just send back some urine sample to us, right? Urine strip, in fact. So it's like a pregnancy test like that.
Is it available already in the pharmacy?
No, it is only available in our lab. We distribute this to all the doctors and
that's good.
Patient directly. So this is one of the key assessment you can use for assessment as well as treatment.
Yeah. Right? Beside for me, like being my initiative is to increase awareness, but also to help them diagnose the children.
Exactly. So that would be a useful thing for you to talk about and promote.
Yeah. I'm so happy when I Google suddenly I found out the address is in KL. I said, wow, this is
Right.
efficient. That is why. I mean, oh my goodness, I say thanks to the God, because to me is I've been looking, because I am looking for my children, to treat both my children, because one is 15, one is 18, and my boy is still remains non-verbal. I do not know, is there anything to do to make him verbal?
Well, definitely we have all this treatment modality. You have already done the diet change, right?
Yeah.
So we can do the the physical, the brain implementation. Then we also have some nutritional medicine, right? So once we diagnose what deficiency there is, we can enhance, right?
Yeah, yeah,
All these transmitters deficiency. There, apart from that, there are
yeah.
also the I mean, since you know nutrition, we have a couple of other lab tests, right? Not only so once we identify that there are deficiencies in these neurotransmitters, we can also do tests to see what are the other nutrients, right?
Oh.
That might be deficient. So we have a blood test for that. What we call the Pfeiffer profile, right? After Dr. Pfeiffer. So these are all the methylation nutrients, right? So Tommy can explain to you what methylation is, but basically it's a biochemical process in the brain, and it is genetically linked. We can also run a gene test to see whether there are blockages, in some of these, the abilities of the brain, to make some of these nutrients available. So all this, once we diagnose, we have solution, because if say there are blockages in say vitamin 12 or vitamin B6, we can prescribe the active form, right?
Yeah,
The active
yeah,
form of B6, the active form of folate. So all this can be
yeah.
solved, right?
So are you saying that with
So
the kind of like when we complete the diagnose part, then we'll start treating them with this kind of thing? I mean, the maybe through medical.
exactly,
Yeah,
exactly,
exactly.
exactly, exactly. Yeah,
I
yeah.
came across the music therapy, Adam. I came across the music therapy also. Do you
Yeah,
have it?
so yeah, we have that as well. Music therapy, art therapy.
Oh,
We also have courses to help train. Professional certification courses on all that. Yeah.
I
So
see.
mm,
Mhm.
so that is
Oh, so God is helping me in a way out, because I've been seeking, since last year, on the treatment, on the channel, so that I can tell the people, okay, I'm so sorry that I record the program. Is the reason why I record this is to bring an expert, and I hope Tommy can do me a favor. I believe people out there, they still do not know that you are in Malaysia. You have the lab kind of thing. If you don't mind, can you say something, Tommy, so that I can share? And if you don't mind, I hope Dr. Edward also don't mind. I make this record for the public.
sure, by all
Okay,
Yeah.
means.
okay, good.
Yeah.
Tom, could you please say something? I'm not really clear on the location, on what is your actually operation.
Oh, yeah. In our International Psychology Center, we not just
Well, yeah.
and well lab also. We provide assessment and also therapy, and also do some lab tests to find out what is the reason that causes the children to have autism. Basically, we can do a lot of different lab tests. Like just now, what doctor say is the advanced neurotransmitter metabolite test. So that test is a test that can find out our neurotransmitter level in the brain. So basically, the test can see is there any deficiency or imbalances in the neurotransmitter level. So if there is, then we can use some supplements to make it balance, and also reduce the issue of autism and also ADHD amongst the children and adult lah. So this is what we can do lor. So you can also find out more about all our lab tests that we provide in Well Lab by going to the malaysialaboratory.com to find all the sample report and all the brochures, all information related to all the tests that we provide lah.
Oh my goodness. I just knew about this today. Thank you so much for sharing.
Yeah, no worries.
Yeah, other than that, Dr. Edward, if you mind, if you don't mind telling me, I just know you today. I do not know what is actually your field, your forte. You know, tell me what is it all about, and are you Malaysian or something like that? Tell us so that we can have you next time maybe.
Of course, yes. I am Malaysian. I've been trained abroad in the UK, the US, and I've spent many years working with experts like I mentioned, Dr. Daniel Ammon, the world famous psychiatrist who also practice nutritional medicine, right? I am the only psychologist license in Asia, under him, under the Ammon clinics to treat and assess ADHD children and adults, right? I'm psychologist who is also trained in nutritional medicine. I have not only a doctorate degree and master's, degree in psychology learning, but also a master's in nutritional medicine, right?
Oh,
So
yes.
so I,
You
I, I
are correct.
combine.
You are the right person. Yes.
Yeah, so I'm passionate about helping people, and then what I bring to the field is a holistic treatment, right? We want to see that the patient as a whole person, not just treating the symptoms, So that has been the pretty much the problem with ADHD treatment, like normally you just look at symptom with drugs, but that do not address the underlying, you know, problem. Of course, yes. I am Malaysian. I've been trained abroad in the UK, the US, and I've spent many years working with experts like I mentioned, Dr. Daniel Ammon, the world famous psychiatrist who also practice nutritional medicine, right? I am the only psychologist license in Asia, under him, under the Ammon clinics to treat and assess ADHD children and adults, right? I'm psychologist who is also trained in nutritional medicine. I have not only a doctorate degree and master's, degree in psychology learning, but also a master's in nutritional medicine, right?
Oh,
So
yes.
so I,
You
I, I
are correct.
combine.
You are the right person. Yes.
Yeah, so I'm passionate about helping people, and then what I bring to the field is a holistic treatment, right? We want to see that the patient as a whole person, not just treating the symptoms, So that has been the pretty much the problem with ADHD treatment, like normally you just look at symptom with drugs, but that do not address the underlying, problem. So what we do in IPC is to offer a holistic treatment, psychological, behavioral, physical, in terms of natural nutritional medicine, and even something, that is also very established, energy medicine, right?
Oh,
So
yes.
that is looking at, the Tommy can share with you. I'll link NutriMed at club, website, whereby there are various energy medicine like frequencies that can really help to restore the brain as well,
Yeah,
right?
yeah, yeah,
So
yeah.
that is
That is a website. Yeah, yeah, yeah. Thank
mm,
you so much. Dr. Edward, come across my mind because one of my ingredient for my bites is actually the herbs, the Malaysian herbs. I
mm,
include three herbs, the the cekur. I do not know whether you
ah,
know cekur. We have pudina, and the other
right,
one is we have ulam raja, uh, and
right,
and I recently got the they call it I do not know what is the name, the misai kucing one. I do not know, but I will try to manipulate to see whether it's okay to be brought into the product, the food product. But since I'm talking to you, I'm taking opportunity. Did you come across any kind of herbs that can be used to treat ADHD?
yeah. I mean, there are various herbs like we have bacopa, right? It is a useful herb. We have things like ashwagandha. It's an Indian herb that can like balance the energy level, right?
Oh, I
It's
see.
called adaptogen, right? So there are the number of herbs and supplements that can indeed help very much. The herb Mucana purine, for example, has something called L-DOPA in it. We
It,
would increase the dopamine. So we also have that in Well Lab. So we have we run a laboratory as well that offer testing and also nutritional medicine, right?
do you
So
ever work with any institute, IPTA or IPTS in Malaysia on this kind of thing?
um, IPTA, that means like what, teacher
Universities for the
university?
It's a
teachers.
public university.
Okay, okay.
Public.
Yeah, not specifically yet, right? But we'll be happy to do that. We are always open for collaboration on that. So if you
Oh,
can do some
pioneer.
introduction for us, yeah, we will be happy to do that. Yeah, no worries. Mm.
I believe we do have like time constraint. I don't think we'll be going until 1 hour, or maybe I do not know. But basically, I am taking this opportunity for the public. For example, my next question will be: you did mention about some of the treatment. It is a holistic kind of treatment, available. I hope it's available in the
Yes.
IPC. Yeah, yeah. Tommy,
Yeah, it is. It
what
is.
is the full address? I can't remember. Which area in KL? The lab, I mean the lab.
It's in Taman Desa.
Taman Desa.
Yeah.
Okay, okay. So I think I will collaborate with Tommy with more like information regarding to this, because what I want to know is maybe the public is seeking to get some of the medication from the lab. I mean, maybe it's available in the pharmacies.
No, that can be all ordered directly from Well
IPC.
Lab and yeah, there is a website that we run that we are affiliated to NutriMed at Club,
Oh,
right?
yes.
So all the nutritional medicine are available there, right?
Oh,
So the Tommy can share with you the you know
mm.
the screen, and we
He
can
have
offer
shared.
yeah, we can offer consultation online or physically as well, right?
Yeah,
So
yeah,
all that is available by our panel. So talking about university, we do collaborate with the International Psychology and Complementary Medicine University, right? So that they also have a website. I know they have a setup in Labuan and also in Europe, right? IPCMU.com. So we can also invite you to because we are affiliated with that university. We can also invite you to be maybe one of the lecturer there, right? You
I
can
hope
send your
so.
you can send your
Resume.
your resume to Tommy, and we can get you on board as well, because that university is specializing in complementary medicine and psychological medicine. So we have faculty members from all over the world, right? Professors from Europe, from US. You can check that out, So that would also be a good collaboration. Yeah, if a university you feel is something valuable, which we do think it is, right? So we need to have more training with people.
Oh,
Yeah.
thank you. Thank you. Tommy, since you are here, I don't mind if you want to share any slides or anything that we can show to the public, or maybe in the future. Or now, I don't mind if Dr. Edward still have time with us.
Well, you can just share screen on the Well Lab website, and some of the the tests, like the neurotransmitters test that we mentioned, the methylation test, Tommy, and then the NutriMed, you can share about like the L-DOPA, the ADHD, the prescription in nutritional medicine, and then also some of the energy medicine like sleep bank, that can help patient to sleep using energy medicine, right? So that's
Because I'm so happy, because to me, of course, I'm so happy, because this is the first time I have opportunity to know what is this all about. Okay, thank you. So Tommy, I had already I'm able to see the slide that you are sharing with me.
Yeah, this is the website, malaysialaboratory.com. You can see, right?
MalaysiaLaboratory.com. Okay,
Yeah, this is your
oxidized LDL lab test for identifying and reversing. Okay.
So this is the webinar that we did on the 8th of September. Yeah.
Oh, I missed
Then,
this.
yeah.
Oh. I'm afraid